Treatment of Fabry disease with the pharmacology Chaperone Migalastat. Definition: Fabry disease is a rare, progressive, and devastating X-linked disorder caused by functional deficiency of lysosomal alpha-galactosides. The resultant accumulation of glycophingolipids, predominantly globitriolceramide (GL3), can be lead to multisystem disease and early death.
Fabry is a disease that's caused by a deficiency in one of the enzymes that are responsible for recycling cells in the body. It's carried on the X chromosome, and carrier females have a much milder disease usually than the fully affected males. Males can have a severe picture of neurologic pain, which leads to a feeling of burning, usually in the hands and the feet. Males can also have problems with the kidneys, which fail over time and can lead to the need for dialysis and eventually renal transplant. They also can have a cardiomyopathy that can be severe enough to ultimately require cardiac transplant. In females, the symptoms can be similar, but they're usually milder and later in onset. Fortunately, we have enzyme replacement therapy. For most patients, the enzyme infusions are effective in stopping progression of the disease and in most cases even causing improvement in the symptoms. We also have ready access to the clinical trials that are going on, many of which are happening here at the Center for Rare Disease Therapy. And so we can work with families to help them understand what might be the best option for them.
Epidemiology. Fabry disease is a rare pan-ethnic disorder, meaning that it occurs in all racial and ethnic populations, affecting males or females. It is estimated that type 1 classic Fabry disease affects approximately 1 in 4,000 males. This type 2 later onset phenotype is more frequent than the type 1 phenotype by 3 or 10-fold, and in some populations may occur as frequently as about 1 in 1,500 to 400 males. Applications in medicine. This disorder belongs to a group of diseases known as lysosomal storage disorders. This enzymatic deficiency is caused by alterations, mutations in the alpha-galactoside A, GLA, gene that instructions cells to make the alpha-galactoside A alpha-GALA enzyme. Lysosomes function as the primary digestive tract of cells. Enzymes within lysosomes break down or digest particular compounds and intracellular structures. Etiology is genetic. Fabry disease is caused by alterations, mutations in the alpha-galactoside A gene located on the X chromosome. Chromosomes are found in the nucleus of all cells. They carry the genetic characteristics of each individual in thousands of specific segments called genes that span the length of the chromosomes. Each of these genes has specific function in the body. Human chromosomes are organized in pairs, numbered from 1 to 22, with 23 pairs of the X and H chromosome for males and two X chromosomes for females. Individuals inherit their chromosome each pair from each partner.
Heart disease and renal failure are both major causes of premature mortality in patients with Fabry disease. Unfortunately, this challenge is complicated further by the impact of these two morbidities on each other. Cardiac involvement is common in Fabry disease, as lysosomal storage occurs within almost all cardiac tissue, leading to progressive structural and functional changes to the heart in over half of male and a third of female patients. Cardiovascular events are the cause of death in over 50% of patients with Fabry disease. Symptoms include dyspnea, heart failure, angina, chest pain, and arrhythmia. These symptoms can be attributed to the accumulation of GB3, which triggers intracellular signaling pathways that lead to cardiac hypertrophy.
Diagnosis. The clinical diagnosis of the type 1 classic phenotype can be made clinical by physicians are recognize the characteristic findings on episodic pain in the extremities, absence and decreased sweating, androsis and hypodrosis. Typical skin lesion, angiokeratoma, gastrointestinal abnormality, and the corneal dystrophy, the childhood or adolescence.
There are over 7,000 genetic conditions, and although I personally believe that Fabry disease is the most important one for every physician to know, you can't know all of them, and all of them are very important to understand. And that's why education for physicians is so important, so they can understand how to prioritize in their patient population, what to really pay attention to, what they really need to think about, and who needs to be referred out to genetics or someone who really understands how to navigate all of these complicated genetic conditions. There are programs that are working on education, events and lectures that are given to try to help patients understand, there are educational events, there are lectures, there are
Symptoms: acroparesthesias, anhidrosis or hypohidrosis, gastrointestinal problems, corneal dystrophy, and renal dysfunction. Treatments: binding of the pharmacologic chaperone Migalastat, the activate site of the alpha-galactoside stabilize certain mountains enzymes, thus facilitating proper trafficking on two lysosomes where dissociation of the Migalastat allow alpha-galactoside to catabolize accumulate substrate.
If you have tested positive for Fabry disease and been to the Royal Free Hospital for assessment, this short video aims to provide information on how the condition can be treated and managed.
Once you've had the organ assessments, if it shows that they're affected anyway, we'll invite you back up to our centre for treatment, which would be enzyme replacement therapy.
Enzyme replacement therapy is given by an intravenous infusion directly into the bloodstream. It works by replacing the enzyme that is deficient in Fabry disease.
So we expect that enzyme replacement therapy will be a long-term therapy for patients who are receiving it. It has beneficial effects and many people feel better from the point of view of their pain and their bowel symptoms, and we see improvement or stability in many people's organ function.
The infusions are given every 2 weeks. You will have the first infusion at the lysosomal
Pro and cons. The accumulation of GO3 in different kidney cells is a known consequence of Fabry disease. Plasma rhizome GB3 has become recognized as an important marker of disease severity, although the primary analysis for intestinal capillary GO3 in stage 1 in patients with mutant alpha-galactoside forms were suitable or the suitable Migalastat therapy did not show a significant treatment effect post out stage 1 and prospective stage 2. analyzed in patients with Swiss-label mutation, provides evidence that significant and durable reduction in kidney GO3 levels. Complications. Cerebrovascular complications as a result of the progressive GO3-GB3 exposure in the heart, leading to atrial fibrillation and the small blood vessels in the brain. About 70% of males and 4% of males present with Fabry disease, respiratory abnormalities, accumulation of vesicles of involucres, and consequent fibrosis can be interstitial lung disease.
Fabry disease is an inherited condition which is due to lack of an enzyme. Enzymes are proteins that break things down, and the failure to break things down means that there's accumulation. And in Fabry disease, substances accumulate in different organs.
The gene for Fabry disease, which is mutated, changed in the disease, is on the X chromosome. A female who is a carrier may have half of the children with the mutation, males or females, who have a risk.
Issue apply in Ecuador. Fabry is one of the 6,000 rare of infrequent disease so far identified in the world, and in Ecuador, 25 people are known, several of them in Tena, affected with this ethnicity. Conclusion. The stimulation of the Swiss evil mutant form of the alpha-galactosidase by Migalastat is hypnotized to increase enzyme levels more consistently than enzyme replacement therapy given every 2 weeks. The higher volume of distribution of the Migalastat than enzyme replacement suggests that Migalastat may enhance alpha-galactosidase levels in multiple organs, including the central nervous system.